Hi, Dr. Backpacker here and kids. And today we're talking about poison ivy because I've got poison ivy actually right now on my knee, and a little bit on my arm. And it's been about 2 weeks. It's drying up at this point, but we're out backpacking again. And here we are in Shade State Park in Indiana. And I'd like to share what I've learned as a patient, physician, and also a Wilderness Medical Society fellow. Poison ivy is a compound leaf of 3 leaves, with the 2 side leaves having a notched mitten appearance and the front leaf being more of a top hat appearance to it. And so poison ivy, poison oak, poison sumac are all part of the same genus, Toxicodendron, which means poisonous tree. And it's in their oil of the sap, or a compound called urushiol, is what we're allergic to, and that's what causes the contact dermatitis. And anyone who's allergic to the oil will have a contact dermatitis or rash to it. Although poisonous sumac can be found in marshy areas of Indiana, poison oak has not been identified by the USDA in Indiana, but can be found in the neighboring states. So some people have never had the rash, but it is always possible they could get the rash in the future. So stay clear of any of the 3-leafed plants. For the rest of us, the more contact with these plants, the more severe the reaction tends to be. You can also get the rash from any part of the plant. It's not just the leaves. Anywhere where the oil is where you can actually get a rash from it. So the roots, the stem, the leaves, anywhere, and even in the wintertime. It's important to remember that the rash is not contagious. It's the oil that actually is what we're allergic to. So you cannot spread the rash to other people. If someone touches my poison ivy on my leg, they can't get it, and I can't spread it to other parts of my body once the oil is off my skin, clothing, and my nails.
If you have an allergic reaction to the oil, you can develop a rash. Most people are allergic, even babies. If a baby or a child has a poison ivy type rash for the first time, particularly if you don't remember having contact with poison ivy, they should see a healthcare professional because some health conditions can cause a similar rash.
Another interesting point, dogs and cats don't seem to get the rash, but they carry the oil on their fur, which can rub onto you. So if you're hiking with your pet through poison ivy, wash your pet afterwards too. Be sure to wear rubber gloves when giving her a bath. And if you come in contact with this plant, it's most important to wash off immediately with soap and water, within 10 or 20 minutes of touching the plant where it's oil. Poison ivy wash, rubbing alcohol, laundry detergent, dishing washing liquid, they all work to get the oil off your skin. There's no need to scrub, just gently wash it off with lots of water. The rash initially shows up in an area of your skin that is intensely itches. And then the rash shows up, which is an area of red, itchy bumps on the skin. Some people might get black spots. Blistering rash or oozing is also common. Then the blisters may form and break open, leaking fluid. The blisters crust over and the rash clears in about 2 to 3 weeks without any treatment. The rash pops up in different places because the oil contacted different areas of your body during the exposure, possibly from under your nails itching the areas of your skin, or by clothing that still has the oil on it. Although the rash clears in a few weeks without treatment, some supportive measures can be taken to lessen the intense itchy rash. Anytime you have difficulty breathing or swallowing after being exposed to something like poison ivy, it may be a sign of a serious allergic reaction that requires immediate help. Go to an emergency room immediately if you cannot breathe. Also, see your doctor if the rash involves around the eyes or mouth. Other serious signs include itching that worsens or makes it hard to sleep. The rash involves most of your body, or if you start getting fevers. Otherwise, treatment actually can be reasonable to do at home if the rash is mild and only involves a small section of your skin. So treatment includes washing everything after contact with the oil. Do not scratch as it can cause an infection. Leave the blisters alone, because if you pop them, it may also cause an infection. And to relieve the itch, you can take short, lukewarm baths or shower, calamine lotion or hydrocortisone cream, cool compresses to the itchy skin. You can also consider antihistamines, such as Benadryl, to help you sleep at night. See a doctor if you think the rash is getting infected or if it is not improving after 1 to 2 weeks. To learn more about wilderness medicine, see the links below.
Make sure to like and subscribe if you like this video. See you at the trailhead.